Well, hey, everybody, this is Robert, and welcome to an Outbreak News TV live stream. I'm live streaming on Outbreak News TV, the channel on YouTube, and also on the Infectious Disease News Facebook page. So you can check it out at either of those places. And if you want to comment, ask a question, please do. And if you have some expertise in any of these areas or any of these topics and love to come on here and talk about it, I love to hear from you. So just let me know. So today what I'm going to take a look at is let me get the right size here. There we go. I'm going to take a look at some of the outbreaks that are going on in South America. And these are primarily arbovirus outbreaks. South America has seen some extreme numbers in dengue fever and some very high numbers in Oropouche. And they're also seeing a lot of things I'm probably not going to talk about today. There's a smattering of hantavirus cases and stuff like that. But for time's sake, I'm going to go over mostly some of the bigger things. And so let's go ahead and take a look at what's going on in South America. Of course, we have to start with Brazil. Brazil's got an incredible issue with dengue fever, though there is some good news. There'll be some good news to pass on. They are by far the largest, the country with the largest amount of chikungunya. They're seeing yellow fever this year. So we'll take a look at Brazil to begin with. And first, let's take a look at the number of cases in Brazil. Well, as of Friday, May 10th, we got 4,603,825 cases. And just to put that into some kind of context, in all of last year, January, South America saw about 5 million dengue cases. So right now, Brazil has 4.6 million. And it's heading for some astounding records, unfortunately. The death toll right now has been almost 2,500 fatalities due to dengue. Last year, I think Brazil was the first time they ever hit 1,000 fatalities in a single year. So this just blew that off the map. So Brazil is having a battle with dengue fever without a doubt. And if we take a look at some of the more details of the situation in Brazil, while not provinces, states or federated units like Minas Gerais, the second one down, and Sao Paulo state have both seen well over 1 million cases right through the first 4+ months. Concerning the incident rate, though, it's the federal district, which is a tiny little part of Brazil. Basically, it's where the capital city of Brasilia is located at. They are seeing an astounding incident rate of 8,761 cases per 100,000 population. Just astounding. So anyway, that kind of gives you a little bit of a breakdown of what we're seeing in Brazil as far as the incident rate. Then if we take a look at chikungunya, chikungunya is closely related to dengue, transmitted by the same mosquito as the Aedes mosquito. Right now, I believe the whole continent of South America is, or maybe all of the region of the Americas, which would be from Canada all the way down to the tip of South America, has only seen a little less than 200,000 chikungunya cases, maybe 190,000. So Brazil obviously is reporting 177,000 chikungunya cases, and Brazil accounts for all 95 of the fatalities in South America. So chikungunya is an issue. I think the next closest country might be Paraguay with maybe 3,000 cases. So yeah, Brazil is totally taking the lead there. And if we take a look at the cases per state and the incident rate, the state of Minas Gerais, I hope I'm saying that right, accounts for about 60% of the cases. They got about 111,000 cases alone, and an incident rate of over 500 per 100,000 people. So Minas Gerais is being hit hard by both chikungunya and by dengue in 2024, based on the numbers. Now, some good news coming out of Brazil is, and this came out last week, that the Ministry of Health is saying that 25 states, in addition to the federal district, are showing either a downward trend or a stable trend concerning incidence of dengue fever. So there's 27 states total in Brazil, 26 states plus the federal district. All but one are showing either a drop or a stable incidence of dengue fever. Only the state of Mato Grosso is showing an increasing trend right now. But this is good news, because Brazil's been through quite a bit with this so far. So the Ministry of Health is continuing to intensify efforts to combat the disease. And the director of the Department of Strategic Health Surveillance Coordination, his last name is Wernick, had this to say: we work with the Info Dengue Group that provides elements for forecasting and evaluating the epidemic trajectory. The latest report shows that 24 of the 27 federative units have already passed its peak. Good news. That is good news. It is difficult, however, to analyze Brazil as a whole because each state has different dynamics. Once the peak has passed, it does not mean that the epidemics in that affected state have already passed, because there are still cases being registered. And he closes with saying that's why the ministry remains attentive and alert. All right, let's go on to the next. And this is just a graphic concerning the dengue vaccine distribution in Brazil this year. And it was sent out to 25 states, the dengue vaccine, dengue, I think it was, the one from Takeda. It went out to 25 states, 25 of the 27, over 1,300 cities. It was 2 million, almost 2,700,000 doses were sent out to those states. And disappointingly, I'm sure, to the Ministry of Health, only about a third of these dengue vaccines were actually given. Let's see, we have 906,000, almost 907,000 doses that were given, while the other 1,760,000 were not. And you can see at the bottom of the chart that by month, February, March, April, and May, how many doses were given. So how many doses were wasted? That's a good question. I don't know that, but Yeah, I have to imagine that the Ministry of Health had to be somewhat disappointed in those numbers. Okay. Now, continuing on with Brazil, uh, the Ministry of Health says they're going to expand the use of the Wolbachia bacteria in this battle against dengue. Now, keep in mind, this is not to eliminate this current outbreak or epidemic, whichever one you want to categorize that. This is more of a midterm to long-term project. And right now, they say 6 municipalities are expected to receive the first releases of Aedes aegypti mosquitoes infected with Wolbachia bacteria in July. I can't pronounce all these, but there's a Uberlandia in Minas Gerais, Londrina and Foz do Iguacu in Parana State, Presidente Prudente in Sao Paulo State, Joinville in Santa Catarina State, and Natal in the capital of Rio Grande do Norte. Okay, hopefully I didn't butcher that too much. And next year, the strategy will be adopted by another 22 municipalities in Minas Gerais. According to the Ministry of Health, Brazil is the first country to incorporate technology. This technology as a public policy to reduce dengue cases, like I said, in the medium to the long term. So how does this work? Well, the Wolbachia bacteria are not found normally in Aedes aegypti mosquito. I think they're found normally in maybe 6 out of 10 of other types of mosquitoes, but not Aedes aegypti. So what happens is the scientists will introduce the bacteria into the Aedes aegypti mosquito eggs. Now, when the male mosquitoes with Wolbachia mate with wild female mosquitoes that do not have the bacteria, the eggs will not hatch. The male mosquitoes with Wolbachia are released on a regular basis into an area by mosquito control. The male mosquitoes with Wolbachia will mate with the wild female mosquitoes, and because the eggs don't hatch, the number of Aedes aegypti mosquitoes will ultimately decrease. And this has been effective in a number of places. Now, before, and we saw this in southern Florida a couple years ago, maybe. Before the mosquitoes are released, there's a community engagement stage set up. They'll be talking to the community and make sure they understand what's happening in their area. It says, furthermore, where the mosquito is released, insecticide cannot be applied because the method is based on population change, replacing mosquitoes that have Wolbachia with those that do not. So during that period of time, they won't be doing fumigation or any of that kind of stuff because they want to know how effective this actually is. Now, according to the Secretary of Health, the strategy has proven to be quite effective, and he gives an example. In the city of Niterói, in the state of Rio, the first to receive the project in research stage back in 2014, they saw a reduction of dengue cases by almost 70%, chikungunya cases by 56%, and 37% in Zika cases. Now, they say the number of cases is much lower than in neighboring municipalities, showing that in the medium and the long term, the strategy can be very important. So where this has been done, there has been conclusive evidence that it does work. Okay, let's move on from that. Back to Brazil. And Zika cases. So far, since the beginning of the year so far, Brazil has seen 3,600 Zika cases and no fatalities to date. Zika's kind of been really off the radar in recent years after, what was that, 2015, 2016, when it was introduced to Latin America and spread throughout. And here in Florida, we got blasted pretty bad with it too. But it's been pretty much under the radar in recent years. Concerning Zika, in Brazil, about a third of all cases, maybe a little bit more than a third, have been found in the state of Espiritu Santo, seeing by far the most cases so far. And their incident rate is 33 people for every 100,000 inhabitants. Okay, let's swing around some other parts of South America, because Brazil's not the only one really getting beat up by dengue fever this year. And we can go ahead and start with Colombia, a neighboring country. They've seen over 112,000 cases of dengue in the first 4 months of the year. This represents a 373% increase compared to that same 4-month period last year. In Ecuador, same thing. They've reported 23,000 cases so far this year, but this represents a 371% increase compared to last year. So, you look at 23,000. We just talked about Brazil with 4.6 million. Doesn't sound like a lot, but that's 371% more cases than they saw in the first 4 months of 2023. In Paraguay, they're even worse off. They've seen about 250,000 cases so far between January and April. This represents an increase of more than 1,800% compared to the same period last year. And like I said, Paraguay is also the country that's seen, other than Brazil, the most chikungunya this year, with over 3,000 cases. So Paraguay is battling arboviruses a lot this year also. Peru's reported over 173,000 cases so far this year. This represents a 357% increase compared to the same time last year. In Argentina is reporting a lot of dengue this year, well over 300,000 cases so far. And this represents an increase of more than 600% compared to last year. Now, Argentina appears like they're taking the next step, and they got together and working on a plan for a comprehensive approach to dengue 2024 to 2025. And it is comprehensive, so there's a lot of parts to it. But the part I wanted to go over with is concerning a dengue vaccine in Argentina. And they say that at the current time, according to the epidemiological situation, it is not a vaccine to be incorporated into the national calendar for all jurisdictions in the country. So it's not going to be part of, everybody's is supposed to get it. It's going to be a focused strategy or a targeted strategy. And the targeted population will be people between 15 and 39 years of age in certain prioritized, probably hardest hit departments based on the epidemiological situation at the time. It will begin in stages and will advance their words, in a dynamic, progressive, and staggered manner according to the availability of vaccines and according to the strategies already implemented by those jurisdictions. Now, it says it is essential to start before the period of greatest viral circulation in order to complete the planned scheme and prioritize the seropositive population. So in a nutshell, it appears that, and just to be clear, this is not to stop the current epidemic. It's to come out in a little bit into the future to stop some outbreaks. Okay, so Argentina, Brazil's already doing it. Argentina's definitely taking a look at it with some sort of a plan. Um, let's switch away from dengue for a moment, and this is actually something I covered on the website. I don't know, last week or so, and you can see the website there in the scrolling across. Outbreaknewstoday.substack.com if you want to subscribe and or check it out, see if it's something you like. So the health officials in Peru are reporting a total of 49 confirmed cutaneous leishmaniasis cases in Peru, known as UTA. I think that's how it's pronounced, UTA. In several districts of Ancash Department in the western area of Peru. Of these 49 people that have cutaneous leishmaniasis, more than half of them are under the age of 11 years old. So that's very sad because this is sort of disfiguring. As you'll see in the next photo, this is what you could see with cutaneous leishmaniasis. This is on, I don't know if it's on the hand or the arm, but leishmaniasis is a neglected tropical disease, and it's caused by an intracellular protozoa called Leishmania. And this affects roughly 12 million people around the world in 96 countries. And Peru itself is one of the most highly endemic countries for cutaneous leishmaniasis. Now, Leishmania, the parasite, has about 20 different species that belong to it. And the pathology depends on the species, and some cause what you see on the screen, cutaneous leishmaniasis. Others cause mucocutaneous leishmaniasis, where you'll see these kind of lesions and stuff in the mucus areas, like the nose and around there, the ear. That's very, very disfiguring. And then, of course, there's visceral leishmaniasis, or you may see it written as called Kala-Azar. And this is where it actually affects the organs, and that's a fatal stage of leishmaniasis. So anyway, so they have this cluster of 49 cases in recent weeks in this area of Peru of this parasite. So something to keep an eye on there. We'll see if that expands any further. We talked a little bit about yellow fever in the beginning, transmitted by the same mosquitoes that transmits chikungunya, dengue, and Zika, the Aedes mosquito. Now, just a couple weeks ago, the Ministry of Health issued a yellow fever alert, reporting the detection of 4 yellow fever cases, including three of them fatalities, over the last 6 months. And the 2 most recent were reported in February and March, March, not last month. So keeping an eye on that. I didn't look up the count for the non-human primate cases in Brazil, but clearly there's got to be some going on there also. But yellow fever is a very, very serious disease. It can be a hemorrhagic fever. And one good thing about this compared to the others, this is a vaccine preventable disease. There's been a yellow fever vaccine. I remember when I was in the military years and years and years ago, this is one of the vaccines I got. So this has been going on a long time. Okay, what do we got next on the plate? Okay, Oropush. So far, now this is the viral disease caused by the Oropush virus that is transmitted via midges or biting flies. So far this year, 4 countries in the region in South America have reported cases. Um, the latest update last week revealed that more than 5,000 cases have been reported throughout Bolivia, Brazil, Colombia, and Peru. Now, to be fair, Brazil accounted for about 4,500 of the cases, so it is the bulk. But that is the biggest change there. And the other difference is, last time I reported on this in a video, as you can see it up there, if you go to the channel, type in Oropush fever, and you'll see the video. I don't know when I did it, 2 weeks ago, 3 weeks ago. So the numbers are a little off, but it's basically the same type of content. And at that time, Colombia, I think, had 2 cases. I think they're up to like over 3 dozen now. So that's a new development in Colombia. Okay, so if you want to check that out, go to the YouTube channel and check that out. All right, next. Suspected leptospirosis in the state of Rio Grande do Sul. Now, that's what's happening there is that they got some massive flooding, as you can probably see in the picture. The state is in the southernmost part of Brazil, and heavy rains have hit this area and have caused a bunch of rivers and lakes in the state to hit their highest levels ever. And the flooding has blocked streets, disrupted, supplies and logistics, and triggering, shortages of essential goods in some areas. The storms and the flooding have just beat the state down. It's just displaced, well over 300,000 people. There's still 100 plus more people that are missing, unaccounted for. And I think the death toll, the latest numbers I saw, 126 people died. What does this have to do with leptospirosis? Well, the Ministry of Health is saying that they're advising, healthcare providers, physicians, nurses, etc., to begin treatment against leptospirosis immediately without the need for laboratory confirmation due to this flooding. Because you're going to have people out there wading in the water. And of course, there's cities, and there doesn't have to be cities, but there's rats. And the rat urine can contain the bacterium Leptospira. And it can go through little cracks in the skin. It can go, if it gets in your mouth, whatever. If it gets in you, it can cause leptospirosis, which can be a very, very severe infection. Fortunately, and especially if it's caught early enough, it's totally treated with antibiotics. So, yeah, so don't have any kind of leptospirosis counts yet. I suspect in weeks and months to come, we're going to start seeing some numbers. But this has affected, like I said, it has affected a lot of the logistics and supply. I know a lot of they've been trying to get more healthcare providers into the area to help out. It says in Rio Grande do Sul, they put up 3 more field hospitals. I think the field hospitals house, like 1,500 patients. So with this, and there's already 5 units set up earlier by the department, and this is helping the state face the problem arising from the floods that have hit the state since the end of April. So, yeah, so and the floodwaters brings with it a lot more, even if I just stick with infectious disease problems, than just leptospirosis. We're talking about skin infections, and we're talking about, other types of infections. And if you ingest it, you're talking about all kinds of, diarrheal diseases. So anyway, this is something at the website. I'll definitely be keeping an eye on the latest on what's going on in Rio Grande do Sul. And if anybody knows anything if you live down there by chance, and you can talk about this. I'd love to hear from you. Okay, moving on to the next. We're getting close. And the last infectious disease I want to talk about, or outbreak in this case, is Western equine encephalitis in Argentina. So, since the epidemiological surveillance started last December, and I reported on the first case Argentina has seen of Western equine encephalitis in a person in over 2 decades, and that happened, just a few days before Christmas. Since that time, over 500 suspected human cases have been reported. In 19 of the provinces, and so far, 102 confirmed cases have been confirmed. The confirmed cases have been identified in 8 different jurisdictions in Argentina. The provinces seeing the most: Buenos Aires province, Santa Fe province, and Cordoba province. Between the 3 of them, they account for 90% of the cases of that are confirmed. Now, among the confirmed cases, 10 fatalities have been recorded to date. Now, of the deceased, because when you get somebody who dies from something like this, is there anything else going on? 7 of the 10 deceased reported having lived, worked, or visited in a rural or semi-rural area, and the other 3 remain under investigation. 7 of the 10 deceased report a history of a previous illness or risk condition, or what we call an underlying illness like diabetes, cancer, or others, which clearly didn't help when you get this infection, having one of these health conditions. And as far as the animals, the epidemiological situation in the animals, since the alert was issued for Western equine encephalitis in animals back in late November, and to date, the National Health and Agri-Food Quality, or the SENASA, confirmed a total of almost 1,600 outbreaks of Western equine encephalitis in horses in 17 provinces. Now, back in January, a mandatory vaccination was established throughout the territory against not only Western equine encephalitis, but also Eastern equine encephalitis for all horses that are at least 2 months old. So there's some good news that goes with this. Now, the number of cases in horses really peaked right around the beginning of the year, the last week of December into the first week of January, when they were seeing almost 500 horse cases per week. And that has decreased dramatically over time. And in fact, there's been no new cases reported in about the past month in horses. So if it's not in horses, the good chance you're not going to see many more people cases too. So that's some good news coming out of Argentina. And Argentina is not alone with this either. A neighboring country, Uruguay, has seen, I think, 5 human cases of Western equine encephalitis. So, yeah, so that's been a problem down in that part of the world. I don't know, going on about 5 months now. So, but hopefully we're seeing some good things happen, and we'll have much to report on it pretty soon. Now, like I said in the beginning, that this is not all inclusive. There's a lot of other things that are going on in South America. I've been seeing a lot of reports of hantavirus cases in sporadic areas around the continent. I saw that Colombia is seeing some issues with rabies, and Yeah, so there's other things going on down there, but these are the big ones. I mean, I reported a couple weeks ago on uh, a locally acquired cholera case in Brazil, something they haven't seen in quite some time. So yeah, so we'll continue to keep an eye on South America and watch as things uh, eventually, hopefully, turn around pretty soon with some of these diseases. All right. Well, thanks for joining me on the live stream. I appreciate it. You can subscribe to the channel. We're at Outbreak News TV. If you're not watching on the channel right now, um, like the video, comment below. I wish somebody would have commented today during the live stream, but I didn't get any. Um, Share it with your friends. I'm going to go ahead and post it on all other social media. And I plan on starting to do live streams on some of the other social media also. I can do live streams on a number at one time. So, and if you want to follow me on some of the social media channels, at Facebook, it's Infectious Disease News, and at X, formerly Twitter, it's Bactman63. All right. Well, I appreciate you watching, and I'll see you next time on Outbreak News TV.